Hi sir, we have an ops consult for you. Can you come and have a look?
Yes, doc. What's the case about?
It's a case of Apla syndrome. Consult is regarding need for anaxaparin.
Was there any history of recurrent pregnancy loss in this case?
Oh, no sir.
Was there any history of arterial or venous thromboembolism in this case?
Oh, no sir.
Yes, I'm going to come and have a look at this case myself and I'm going to ask history in detail. Before that, I need to clarify what do you mean by antiphospholipid syndrome. Just the mere presence of antiphospholipid antibodies is not equal to antiphospholipid syndrome. According to modified Sapporo criteria, otherwise called as Sydney criteria, you need to have a combination of both clinical and laboratory features to call it as antiphospholipid syndrome. So what is the clinical criteria? Number 1, you should have history of arterial or venous thromboembolism. Number 2, you should have history of recurrent pregnancy loss, or simply we can call it as pregnancy related morbidity. Out of these two, you should have at least one. Along with that, you should have one of the APLA antibodies to be positive. So what are the antiphospholipid antibodies? Number 1, we have the anti-cardiolipin antibody. Number 2, we have anti-beta-2 glycoprotein 1 antibody. And number 3, we have the lupus anticoagulant. Out of these three, you should have at least one to be positive. And only when you have a combination of one clinical at least and one laboratory picture at least, you're going to call it as APLA syndrome. In your case, your clinical criteria is not fitting into the diagnosis of antiphospholipid syndrome. So this patient is likely having only antiphospholipid antibody positivity. So in that case, you need not really start with enoxaparin, rather just a low dose aspirin is going to be more than enough.
Thank you sir. Please come and see the case first.
Hey, you cannot just like that go by saying a simple thank you. You along with the viewers should be able to answer this question as well. According to Sydney criteria, after how many weeks you need to repeat the antiphospholipid antibody test to call it as persistently positive so that you can call it as an antiphospholipid antibody syndrome, which is something that we have not discussed so far. Mention your answers in the comments below.